So good morning, everyone. 396 days since our first case of the outbreak, 57 weeks ago. And, and unfortunately, we lost 3 county residents over the weekend, 1 on Saturday, but 2 last night. A woman in her 60s, a man in his 80s, and the one on Saturday was a woman in her 70s. That brings us up to 369 people that passed away from COVID-19. And my heart and condolences go out to the families and prayers. You know, it's a difficult time to lose anyone in these tough times, but even harder when you couldn't say goodbye. If you remember early on, you couldn't have a funeral, you couldn't have a wake service, you couldn't properly bury your loved one. And a lot of people push it off to farther in the future to say goodbye on their terms, and hard to lose somebody when you can't be by their side in the hospital. So again, my condolences to all the families. As of yesterday, 44.8% of Albany County's population has received at least 1 dose of the vaccine. An estimated 31.2% has completed the vaccination altogether. Compare that to the statewide, 37.4% are fully vaccinated with a rate of 24.4%. To date, Albany County has administered or reallocated 46,018 first and second doses of COVID-19. To Dr. Whalen and her team, thank you for everything that they do, and the partnerships that we formulated over the last couple of months, and actually the last 57 weeks, of getting things done, not just with vaccines, but everything else. Albany County alone has administered 29,233 doses at our own clinics at the Times Union and Cap Center. Again, to her team, I say this to the press, walk around with Dr. Whalen and her team members, and you be surprised, not just with the medical corps, but the people that have volunteered there, it's just been incredible. Albany Law, the president of Albany Law, other people that from different walks of the community that just go in there, and the one common denominator is they're always thanking Dr. Whalen and her team for the approach that they take, for the friendly approach, but also getting it done. So thank you. I want to say on Saturday we partnered with Crestwood Pharmacy at Bethlehem High School. That was a huge success. To Jay Bertel, thank you, Jay. To you and your team, and to the superintendent, Judy Monroe, and the principal, David Domel, that was outside directing traffic, and I didn't recognize him with the mask on. And I was kind of chuckling when I walked away, and Dan Lynch, my deputy, goes, "That was the principal." And I'm like, oh, I didn't realize that. But the team approach, from the superintendent to the principal, to the parents, to the 400 students who got their shots, it was a huge success. And I want to thank everyone that was involved. So we've also, I said last week, we talked about it. We've been talking to Superintendent Corr wants to do North Colony and Shaker and have hubs there, or pods there, I should say, not hubs. Quanah Adams from Albany, Jay Berteller's already reached out to Albany School District about setting up a pod this week with them. And these are things we're going to get done in partnerships, and making sure we get our students the shots. I think there's only, 9 weeks of school left, if I'm somewhere in there, June 22nd, if I stand corrected. It's tough. It's tough. And these schools have been remote. They had to learn how to do remote learning last year. Some schools didn't come back. Some have a hybrid model. Some have different things, and the guidance keep changing. And, one of the things we talked about, and we have to siphon through this, and let me tell you, I think Dr. Whalen's team, besides being medical experts, they have to digest the guidance that continues to change or come from the State Department and figure it out and figure out an approach, which makes it tough on them, right, with everything else going on. But on March 12th, CDC put out their guidelines, 3 feet apart, 6 feet apart in gym areas, stuff like that, that the students couldn't meeting, and high risk areas based on the matrix and everything else, and I could go on. Well, we were waiting and continued to say we're waiting for the state. Well, the state, 10th of April, Friday night, I believe, dropped theirs. 24 pages. 24 pages. I wish someone in the health department would talk to the people in the trenches, talk to the school districts, talk to our health department, work together. I mean, I actually was reading through this and highlighting it, and I think it was until like page 5 it got to the 3 feet and 6. I know. I don't know why I read it, but it's I don't know. I guess it makes me laugh at this point, 57 weeks later, but I'm not surprised. We're in this together, and they should work with us. And the health departments, to the school districts, they got to go through this ventilation. If they don't have ventilation, inspections, air filter change, opening up windows. I'm like, I was reading all this guidance from the state, and I'm like, yeah, they've been doing this. They've been open. But again, when you only have 9 weeks of school left, and they're already struggling with kids coming back. I know the Albany School District came back today, gave the option for high school students to come back and middle school. The kids that want to come back, and then you get the week of vacation, and you say, okay, but they've been doing this. They got to submit their plans to our health department and get it okayed. But again, on top of learning with all the guidance and hard work for these superintendents and principals and vice principals and the teachers and the administrators in these schools, it's tough enough. It's been tough. President Biden said back in early March, before March, a priority of his administration was to get kids back in the classroom, and they were going to get kids vaccinated. That's why Dr. Whalen and I sat here and advocated for 16 and above. Well, you can't get them back if they're not getting vaccinated, and you got to make sure you take care of the teachers that are in the classroom. Teachers' safety and health are a priority to make sure, as well as the students, as well as the janitors, as well as the security guards or the food people. I don't care what you do in the school system, you're on the front line, and we got to make sure everyone's protected. So I do want to say to everyone there, thank you, but to President Biden, it was a great initiative, but here it is, April 12th, I believe. Is it the 12th? I hope it is the 12th. Is it
I have
something?
to check.
I
Yes,
have to
the
check.
12th.
Thank you. Sure, every day's meshing. But again, we can get through this working together in a partnership in communications. I said this to the State Department of Health. I know they're working hard and they're doing a lot of things. Reach out to the people that are in the trenches, just like with the vaccine early on. This is what we train for. This is what we do. This is what Dr. Whalen and her team do day in and day out. And I want to say, they're the ones that know what can be done in the right way to get things going. So again, to all the superintendents, thank you. To everyone getting this done and effective, great. It's 3 feet from 3 feet in the classroom, and then for high school it's 6 feet apart outside the classroom in high intense areas like gyms, hallways, locker spaces. Even in the state's guideline it says they should rent space from outside areas if they can. Okay, the school budgets are in trouble, money's tight. I don't know how the logistics of doing that, but great intention. But again, there's it's been 3 weeks since the guidance, and there's 9 weeks left to the school district. So some of the conversations I had with some of the superintendents was that we should be prepared for next year. We should be prepared for the fall. Getting shots in these kids' arms is so important. So I said to the parents, please, with the visor, please pay attention. We have, I think, 3,500 vaccines she is going to receive this week, hopefully. That's what they told us. And we are going to make an admission to get into schools, to get these kids vaccinated. So we need partners, and I want to thank Joe Core and Quiana Adams, and obviously Bethlehem for their partnerships, and to all the high schools and schools that want to partner to make it a priority so we do this safely. Protect our kids, and quite honestly, if you look at the CDC guidelines, the mental health and services that these kids are missing, and kids with learning disabilities and spatial issues and different things, we need to get them back in the classroom. We need to get them learning and get them back in a routine. So it's going to take everyone to do this. I do want to thank Mayor Patricelli, Mohawk Ambulance, and for the pod that we had on Watervliet Dome. It was a great success, great job that they did to the mayor and everyone out there. These partnerships are working, and we're getting a lot of people done too. And Homebound, I want to thank everyone that's been working on Homebound to get this done. Colony EMS, Gilliland EMS, the Sheriff's EMS, but Dr. Whalen and her team that have been doing Homebound too, on top of the pods, on top of everything else you got going on. I don't know how you do it, but they fit it in where we can't get people, and like the Mission and other places like that, and people have been home. So thank you to your team for doing all that stuff. Quick reminder, and Dr. Whalen will talk about this, those that are 16 and 17, you need your parent with you, or you need a note signed saying that you can get the vaccine. Very, very, very important. We don't want to turn you away. So please make sure, and make sure when you register and use our pre-registration that you're using the right vaccine. Pay attention when you sign on to places, because kids that are 16, I'll let Dr. Whalen talk about that. But please pay attention to that. But as of today, there's now totals in the last 57 weeks, we have 23,014 cases of COVID-19 in Albany County to date. We have an increase of 44 positive cases since yesterday. Yesterday we saw 65 new cases. The day before that was 64. So our 5-day average is 61.8, and the week before that was 63.4. So we've gone down a little bit. There's currently 1,080 people under mandatory quarantine. Yesterday there was 1,175 people under quarantine. And out of the cases that we had today, 17 had close contact, 3 are healthcare workers, 1 reported traveling, 23 don't have a clear source of infection. As of today, 22,494 people have tested positive for the virus and had recovered. 49 recoveries since yesterday. Unfortunately, we've had 3 new hospitalizations overnight. Currently 27 people in the hospital, and yesterday that number was 29. There are 6 people currently in the ICU. Yesterday the number was 6. Albany County's 7-day average for percent positive rate is now 2.6. That's kind of creeping up a little bit, so we got to watch that. The Capital Region 7-day average is 2.4. So please, COVID is still here. It's still a threat. We still got to pay attention, still wear a mask, cough into your arms, clean your hands, stay 6 feet apart. Yes, if you are all vaccinated in the same room, you don't have to wear a mask. Someone comes in there that's not vaccinated, you have to. There's the other variants out there. We haven't seen much of it in this area, but it is affecting the New York City area and other parts. We got to pay attention, stay vigilant. And Dr. Whalen can talk about some of the things I was reading about, wearing a mask, how it's really changed the flu season, allergies, and a variety of other things. So even though we get to that 70%, this might be the future thing that you see continuing, and see a lot of people continue to wear a mask. So we need to continue to encourage people to vaccinate. Like we said the other day, there's going to be a lot of vaccine rollout. Hopefully we'll see more than we're seeing now than the 3,500 that have come in this week. We're going to see more of J&J and the rest of them. So hopefully, and I'll say this in a partnership, working with everyone, we've been communicating well with most parties in Albany County for the most part, about not trying, it's going to get into the Hunger Games of trying to find people to get shots, and then you get to the point where Dr. Whalen has to decide how big the pods are going to be, because you're going to have that people that are going to come in, when you're trying to fill the shots and get the vaccines in arms. So it's going to be more partnerships too, like with school districts and other places to get the vaccine out. And as our number continues to grow, which will be a good thing. Check to see if you're eligible. Please go to the website or go to the hotline 1-833-697-4829. As always, United Way, the 211. I was just talking to Pete Gannon over the weekend. They're still getting phone calls. They're still getting questions about it. People are still kind of like confused. Into the people that are, over the age of 60, please, if you didn't get it, get it. I know one person that's 62 and they're hesitant, and I keep telling them it's the right thing to do. Be part of the solution, not part of the problem. I know people have issues and how it came out. Trust me, when CDC recommends something, Dr. Whalen can talk about it, that it's done right. The science is behind it. It wasn't just something they rushed out there to just try to do an experiment on 300 million Americans. So trust me. But on that note, Dr. Whalen.
Good morning. I also want to continue to recognize the work that our staff is doing. They are doing such an amazing job in terms of our vaccination clinics. And this week we look forward to hitting our 30,000 mark of people that have been vaccinated, our pods. And again, we could not do this without our Medical Reserve Corps. So the thought that, we have hundreds of volunteers coming out to help, many medical professionals, continues to humble and amaze me. They are a great group of people. There is great energy, and we're doing great work. So we're looking forward to continuing to do that. As the county executive indicated, this week we got a shipment of Pfizer vaccine. And Pfizer, as you know, is the shipment that can be given to 16 and up. We've received 3,510 doses of Pfizer, and we will look forward to getting that out and particularly earmarking a large percentage of that for the 16, 17-year-olds. So I want to make a note of that, because now we're looking at parents thinking about options for vaccinating their children. And I know I speak here as health commissioner and say that this vaccine is safe and effective, but I will also speak as a mother of 3 children, and one of my youngest is 16, and I have an 18-year-old and a 20-year-old. I will ensure that all 3 of my children are vaccinated, and I do this because I believe in the safety of the vaccine. So I want to put that out there to parents that, just so you know that it is something that I feel comfortable vaccinating my own children. I have been vaccinated myself. My elderly relatives have been vaccinated. Many of my family members have been vaccinated. I encourage this as the way to stop the pandemic. It really is the best way that we can move forward. We know that that there is interest in obtaining an EUA for Pfizer for kids from 12 to 15. And that is something that is currently on the table. And if we get guidance on that, that'll be a further expansion. We know that when we look at transmission, our teens are higher rates of transmissibility than younger kids. And so the school guidance that came out this weekend, which is very complicated and very long, really what it enables schools to do is that schools and districts can choose to reduce the distancing to no less than 3 feet. They still recommend 6 feet between students and any adults. They still recommend 6 feet during meals, snacks, or drinking in certain activities, such as gym to the extent possible. They still recommend 6 feet for activities in which children are projecting their voices, such as singing. They still mandate face masks in school. There is additional guidance on ventilation and filtration. The CDC has suggested elimination of physical barriers, and they are strongly suggesting that districts consider testing within the school environment. Furthermore, they do discuss recommendations, be in consultation with school boards, with parents, and with local health departments, and that recommendations can be dependent on the risk in a particular community. So this is not a one-size-fits-all, but rather a district-by-district decision. We look forward to working with our school districts on this. It is a lot to digest and a lot to implement. But they have been phenomenal partners so far. They have really demonstrated since day one a willingness to do everything that they can to ensure the safety of their students. And as the county executive indicated, and as we know, it is important for kids to have the structure of school to be able to get back into in-person learning. We know that there have been many effects of kids being out of school on children, on families, and to get back to this particular aspect of normalcy is important for us as a society. So we're going to have a meeting later today to plan vaccine strategy to get out this week. It is a lot of doses, and we look forward to getting it out within the week's time frame that we have. I do also want to mention to parents that we have discussed in these press conferences often how one side of the fact of the pandemic is that people are not getting routine care, routine medical care and physicals and following up on chronic health conditions. So particularly today, I do want to address to parents that it is important to keep up with your regular scheduled vaccinations for children. We heard of a case of measles in Connecticut this weekend. Measles is a highly, highly contagious virus that can have severe side effects. And this really speaks to the need for parents to ensure that their children are immunized per the schedule for other vaccine preventable illnesses. So I do want to ask parents to make sure that you have your yearly update with your pediatrician and make sure your child is prevented against all vaccine preventable illnesses. We look forward to continuing to work to get this vaccine out. Although we will be targeting high school students, we know that there are many that still have not been vaccinated. So there will be vaccine for others that are eligible. We want to particularly ensure our high-risk individuals, such as seniors and those with medical comorbidities, be vaccinated. And we're also continuing to target getting vaccine out in an equitable fashion. So this includes working with many community partners, community-based organizations, and with particular focus on our Black and Brown communities to ensure that we have the infrastructure and education available so that residents can develop confidence in the vaccine and feel comfortable coming forward and getting vaccinated. It is time to start looking beyond the people that were first in line clamoring for the vaccine to those that may have been sitting on the fence and wondering, should I or shouldn't I? I will say that, our rates of COVID are steady at this point. And that is a concern that they're not starting to drop off. We know that around the country we are seeing clusters with variant cases, and we know that we are seeing continued spread. We know that we continue to see hospitalizations in our county, and unfortunately we continue to see deaths. We need to continue to work to prevent this. Now that we have the vaccine, we need to continue to work as diligently as possible with our community partners, of which we are all grateful to work with, to get this vaccine out, and we will continue to do that in the coming days and weeks.
Thank you, Dr. Whalen, and again, thank you. And I know Albany just gave you a nice little alumni award over the weekend, so congratulations on that. Well deserved. And to all alumni, Albany, I think it makes up like 50,000 people in the capital region. So great job to everyone that goes there and has done extraordinary things in their fields. So I also just want to, I should have said this about the Watervliet Dome. That was our biggest outside clinic besides the one we run in the health department, besides take Albany out of this and Washington Army, but we did over 740 vaccines that day, which was our besides our Times Union pods and in a partnership, it was one of our bigger ones. So Ambulance, who got that off did that with the mayor and everyone involved, Alliance Health. Thank you. I did want to say that. And Dr. Whalen, again, we both talked about the school districts, so it's important. We want kids back in the classrooms, but we want to do it safely. And there's a lot of things that the school's got to siphon through. I also want to remind everyone, please go to albanycounty.com to view all the different testing locations across the county. We still need people to go out and get tested. It's not over with. Please go out and get COVID-19 testing. If you feel that you don't feel good, or just more importantly, if you feel you're exposed, please go to our pre-registration for our vaccine pods that are set up. It's a very helpful tool to us. We got the wait list that people can get on. So again, please, by all means, do that. Also, our mental health support line's available 7 days a week, 8 a.m. to 5, 518-269-6634, as always. And we did see a huge drop last week on phone calls, and again this week, so, or last week, the last 2 weeks. So it's there if you need it. And as always, our 24-hour sexual assault hotline number is always available for everyone out there, 518-447-7716. And we have texting available, email, so people are afraid to use the phone. Please, the support from this organization, I can tell you, is second to none. Karen Ziegler and her team is there for you. They're going to listen. They're going to get you the help that you need, and be there. They're going to be that support for you going forward. So please know, too, when you call, no one knows that who you are. It's not shared on the outside. It's all in confidence, so please feel free to call. That's what they're there for. Again, I want to congratulate Dr. Whalen and her team, or Dr. Whalen for her award this weekend. There's a nice little announcement I got from city and state, upstate Power 100 people into being a category with Mark Marinello, who took over for me as president of NISAC back in October, and Duchess, and Ryan McManus from Ogden County, Steve Newhouse from Orange County, Pat Ryan from Ulster, and Mary Ellen Odell from Putnam, and Ed Date from Rockland to be in the top 10. It's an honor, but again, it's like the health departments. No one really knows what the county governments do in the state of New York, and the same with health departments. Unfortunately, it takes a situation like this to let people realize the services that we provide day in, day out, 7 days a week, and the stuff that's mandatory for us to continue to deliver, from speech, OT, child, transportation, mental health, health. I could just go on and on to everything that we do in the county. I'm not happy it took something like this to highlight what you do every day quietly and what we do every day quietly. But again, to everyone involved that makes us shine, thank you, thank you. Please stay safe out there. Wear your mask, cough into your arm, clean your hands, and stay 6 feet apart.